Thanks, Ryan. We're headed to the Fox 11 Fieldhouse this morning. The following medical segment is brought to you by Aurora BayCare Medical Center. Here's Benny Peterson.
We're here today with Dr. Jon Henry, a board-certified orthopedic sports medicine surgeon at Aurora BayCare. And Dr. Henry, today we are talking about the latest techniques in cartilage repair. Now, can you first explain why a patient may need cartilage repair?
Happy to, Benny. Glad to shed some light on this topic. Let me first explain that we're talking about articular cartilage. That's a Teflon coating on the ends of bones, and particularly in the knee. And patients will know they have a problem when they have pain or catching or locking. And if we find through the evaluation process that there's a focal, full thickness cartilage defect, then we can discuss a variety of different options. The evaluation and treatment process is important because these lesions can eventually lead to other problems such as arthritis.
And what types of cartilage treatment options do you offer to help get patients back on their feet?
Yeah, good question. There are a number of options that can range from bone marrow stimulation to cartilage transfer, often called OATS, to cell-based cartilage transplantation. There are some regenerative medicine techniques that don't cure but can help to compensate for these lesions. Ultimately, if the degenerative process persists or other options fail, then people can look at joint replacement.
Wonderful. Thank you, Dr. Henry. Now, for more information on Aurora BayCare specialized orthopedic teams, head to aurorabaycare.com/ortho. And good day, Wisconsin, and we'll be right back.